Thank you, President Taylor, Bishop Persico, faculty members, and the Board of Trustees for granting me this honor to be the speaker to our very first graduating class here on our Ruskin campus of Gannon University. This is an historic occasion for all of us, and I want to congratulate our new grads, as well as thank you for your faith in coming to a program that was brand new and had yet to be accredited. You have helped us shape not only the future academic programs here, but the design and character of that new building going up down the street. We're all proud of your efforts in the classroom and the clinics, but also your willingness to give back to this community. You'll be forever tied to this place and to these people, no matter where your careers take you. It's a privilege for me to pass on to you some of what I've learned since I left the Erie campus to attend the College of Medicine at Ohio State. And so my goal is to pass on to you the ultimate secret, the key to happiness, joy, and pride in your chosen profession. Before I get to that, I want to talk about two of my mentors. And the first is Father Joe Gregoric, who was my advisor. He was also my professor of anatomy, embryology, histology at Gannon. He's truly a Gannon legend and one of the last breed of priests with impeccable academic credentials in the biological sciences. Father Joe demanded us to be prepared and ready in the classroom, but more importantly, he had a willingness to share with us about what we were going to face for those of us who were going into healthcare. And so he would talk to us about the spirituality of being a healthcare provider, about it was an honor and a calling and a great responsibility to care for others. That view was reinforced to me by Dr. Bill Havener, who was another mentor and my chairman in the Department of Ophthalmology at Ohio State. Bill was one of the great surgeons of the 20th century, and he made sure we were ready for every aspect of our procedure. But he also told us it was our duty to reassure and educate our patients about their illness or upcoming surgery, that they could only be fully healed when we took care of that side of the equation to make sure they understood and became part of our treatment plan. And all of you know how important it is to have compliance with your therapy. So that's where the relationship with your patient is so important. All of us realize the fragile nature of healthcare, and we all know that we're all going to face tragic and stressful situations. Each of you will. And there's going to be days you're unbelievably tired and you'll do anything not to have to face another patient or their families. But you'll compose yourself and you'll do what you must do. Let's talk about how you're going to face those days. I suggest that you look at your patients, and you're going to see a wide spectrum of patients. And most will do very well, and they'll follow your treatment plan, and they'll move on with their lives. You're always going to have those cynical few that are going to go into distress and terror at the moment of even a mild illness. But then there's those incredible few that can face anything. The most tragic of circumstances, they are there with a positive attitude, compliant, and do everything that you would expect them to do. So our patients have a message for us, and there's a common denominator with those that seem secure against the world, no matter what life throws at them. Almost always, those that are most equipped to face those challenges have an abiding faith, a secure knowledge that their God is with them, even when facing difficult circumstances. You know, when I was your age, many of my fellow medical students, they didn't know about God, so they felt atheism was the only way to go. After years of observation, I'm certain that the patients who know that they have a God with them are better off. No question, there's an enormous difference. So what do we do about it as healthcare providers? Oh, I'm going to paraphrase an old parable and compare the viewpoint of three different stoneworkers. They're all working on the same project. The first one sees his job as carrying stones. The second one of building this endless wall. The third one, he works down in a trench digging what's going to be the foundation of a beautiful cathedral. And every day he walks home covered in dust, and he looks back and he sees in his mind's eye that cathedral that he's never going to see finished. But he knows that that's going to be a place of worship and celebration for families for centuries. If you're fortunate to consider each of your patients as God's holy cathedral, as a very special and individual person, you will have discovered the true joy of being in the healing professions. It can take a very long time to do this, and some days it's going to be very difficult. But most of the time, I can free myself of my own concerns and go and take care of that patient with the best effort that I can and give them my full attention because I know they're deserving of my skill, and that's what I'm going to do. And that's what you're going to do. So your patients will be satisfied when you treat them this way, and so they're going to be grateful what you're doing. And how could you not want to go to work every day when you're surrounded by grateful people? The most important thing I'll say to you is that you should live your life as if there is a God of love who cares for each of you and each of your future patients. I know this to be true. You don't see them in an ICD-10 code or a CPT code, but as God's holy cathedral that you are privileged to build and to maintain. When you look about your world, you'll see what I begin to tell you is true. That's the ultimate secret. It's the key to happiness, joy, success, and pride in your chosen profession. You cannot fail with this belief. You know, if we have a GPS to guide us, we usually get where we're going. So my intent today was to just demonstrate the sequences of thought and action that will help you in the consideration of your future patients. I also hope you realize there's a very special pathway through this life that will allow you to permit the most important person in your life to be successful. Now, that person's you, of course. So you have to remember to step away from what's going to be a very challenging profession so that you can move forward with your life in a positive manner, so that you can realize the goals of your patients and allow them to do likewise. Remember to take that time to meditate, to pray, to eat well, to exercise, to go take a walk on the beach or sit and watch a sunset. Enjoy the company of the family and friends that are here today and allow them and others to bring you joy and perspective. Young men and women, friends and family, I hope that you will live your life as if there were a God of love that cares for each of you, because there is. I wish all of you the best in your wonderful profession, and please know, it's been said many times today, that all of us here in the Gannon community are here for you, not just today, but the rest of your lives. We're very proud of your efforts, your willingness to give back to others, and the skills you've acquired during your training. The foundation you've created will be your legacy for the thousands of students yet to come here. Thank you all, and God's blessings to each of you.